Hello, good afternoon, everybody. My name is Davis McKenzie. Ajay Cheput, Ajay Mathawat Kwatnam, Davis McKenzie. I'm a Director of Communications with the First Nations Health Authority. Thank you so much for joining our broadcast today. We're really excited about the subject matter that we're going to share, and we're really grateful for each and every one of you taking time to learn and support your respective clients in this transition that's coming September 16th. I've got the honor of sharing the words that go before all others today to start us off on the right foot. So I'd like to acknowledge that we are broadcasting today from the shared Coast Salish unceded territory of the Squamish, Musqueam, and Tsleil-Waututh people. And I'd like to take a moment, I'm from Tla'amin Nation, and just offer a little bit of a prayer in our language before we get going. I hope there's some other Ayajutham Tla'amin speakers on the line, because you'll understand what I'm saying, and you can tell I'm just a kindergarten speaker, but working on it. So I think we'll just stand up in the room and share here. Okshete gus amsman, chechahatash te tintok. Chechahatash Kwane Tomothok, Gayathish to Tikiwith, Gayathish to Lachlach, Chechahatash Ixnams. Thanking the Creator for this beautiful day, for each and every one of you doing this work, one heart, one mind. We're asking for special prayers for our clients, our relatives, our people that are struggling with many health conditions, and ask for loving protection for our relatives who are traveling, and also the elders and the very young children today. So. With that, again, thank each and every one of you for joining. We've got a very, very talented moderator with us today, who's from actually my sister community, Klahoose First Nation. So we definitely are related somewhere along the way. At this point, I'll turn it over to James Delorme, who will bring us into the session. Thanks.
Thank you, Davis. Much appreciate that. And echoing Davis's words in Ayajutham, Eimot Samswagan, Hochu, Happy, Nishta Skeje. And basically what I said is, with my Jeje over here, is that I feel good. and we come from this place, and we're all related. And I think that's, when you start off a meeting, you got to bring a little bit of laughter, of course, and then you also got to bring that we're all in this together. So thank you, folks, for joining us today. Just a little bit of housekeeping to start us off. Love to hear from you. Of course, we'll have a section for taking questions. I know you might have a burning question that you'd like to bring forward. But what we'll do is we'll get through the presentation first, and then we will do the questions afterwards. And we'll start with some of our presenters. Davis McKenzie, who you just heard from, Executive Director of Communications and Public Affairs. Yours truly, James Delorme. I'm a Community Relations Rep in the Fraser Salish region. So I know firsthand some of the great things that we're doing in communities. And you are, as working with Friendship Centers. Laura Dale is on the call as well, Manager Claims Policies and Standards for Pacific Blue Cross. Thanks for joining us, Laura. We also have Darren McKnight, Director of Benefit Management with FNHA. Hero of mine, a mentor. Way to go, Darren. Keep going. Thank you so much. And we also have my manager, my direct manager, Andrea Oberdiek, and she's a Community Relations Manager. And we work together quite a bit in community to do a lot of the frontline work and make sure that the message is getting out as best we can. So I know you have a lot of questions and things that you want to come up with, but as I mentioned, we'll go forward with the presentation, and feel free to leave questions on the site here, and then we can take some messages later. So thank you for joining us. I'm going to go on our next slide. So some of the objectives that we're trying to achieve today is, number one, inform community health professionals about changes to FNA benefits coverage. Number two, provide resources to help FNHA clients navigate the plan. That's a huge one. Number three, answer questions about the transition. Next page. To ask a direct question in the webinar, just a little more housekeeping. Submit your questions during the webinar through the quote-unquote questions function. You'll see it on the right-hand side. Due to the volume, we may need to group similar questions together during the question and answer period. So I realize everybody's busy and they have only so much time today, so we want to make the best of what we have today. Next slide. So a little bit about the health benefits program. It's a BC Medical Services Plan Premium. Ambulance invoices and other items are under that services. They fall under 6 health benefit areas. Number 1, dental, vision care, medical supplies and equipment, or what we like to say, MS&E, pharmacy, and also Plan W, medical transportation, and mental health. So unfortunately, you didn't get to see these nice posters, but now you get to see them. So these are some of the folks that are involved with us. Brush up on your new dental plan. Seeing is believing, no doubt. So what's happening September 16th? So this is with the plan, dental, vision, MS&E. F&H clients do not need to re-enroll. I just want to really emphasize that. That's a really important thing. We get that a lot in communities. They're wondering where they have to go to register or sign up. And we always assure people that is for your member profile for PBC. No one has to sign up for anything. Providers have been notified, and I think that's a key thing to remind folks is service providers. We've done a huge campaign to go out and talk to service providers. Our provider team has completed a huge amount of data to go out and talk to service providers like dentists, pharmacists, people in vision, and to make sure that they understand what is happening and what is going on with the transition. We've had a huge response back from them. Really happy with this transition. Clients can check the coverage by calling our number. Darren has it by heart, which is awesome. Way to go, Darren. Signing into their personalized member profile at pacificbluecross.bluecross.ca. So that's the domain. But you can also visit us again, FNHA, and our benefits page. Lots of updates going on as we mentioned. Community and provider engagement, that was another focus point that we went over. 50 plus community focus groups we've held, lots of provider interviews, and we did the First Nations Health Directors Survey, which gave us a lot of feedback on plan design, to help with plan design. So I was part of quite a few focus groups. We had them all in 5 different regions. We got a lot of data, and it was really that data from the community members which provided us the direction and the focus of going forward. So a lot of those things that you're going to see in plan design were part of the community and what they wanted to see, their vision. And now we're in a phase of information sessions. So if at any point you're interested in connecting to get more information out to your group, to your friendship centers, we're more than willing to come in all the 5 regions. For instance, in the Mission area, I go see the Mission Friendship Center and we do info sessions with the urban membership. We do that on a regular basis. More than willing to do that, you just gotta reach out and ask us. So there's the list if you didn't see that before. And if you didn't see yourself and you're part of this discussion, please let us know. There's a lot of different friendship centers there. Fraser Region, Mission, Friendship Center in Kelowna, Interior Region, various areas of Vancouver, Victoria. So I'll go over again. The partnership in April was signed, 5-year service agreement, Pacific Blue Cross. It's a nonprofit society, been around for about 75 years, believe it or not, BC based. So they signed a declaration of commitment to cultural safety and humility. So that's the key piece that we try to focus on because we know how important that is for our community members to feel comfortable with the people that they're working with, especially with their health. So I'm sure you can agree that how important it is, that commitment to cultural safety and humility is for us to sign that with Pacific Blue Cross. All the claims are processed in BC. So to give it some context, most claims are under non-insured health benefits are processed in Ottawa and some in BC, but all the claims will be processed now in BC. That's going to cut out a lot of time that clients have to wait for approvals and for treatment. Once again, I'm going to talk a little bit more about the strong provider network. It's important that that relationship is strong. And why is it important? Because when a client comes in for service, that service provider should be able to find out exactly the decision that needs to take place in a manner that doesn't cause any more delays, causing grief to that client. Because we know what that means for our people. So that's why this relationship is really important. So a little bit more on the website. Now you can actually see the slides. You can actually see the website. That's a little bit of a design that you can see. Important to note that your status number is also your member ID number for Pacific Blue Cross. And the ability to go online, you can actually see your full visibility on your benefits coverage. And you can also print out your own member ID card. The interesting part is the Pay Direct Provider Network. So that's where we're going to see a lot of wait times are going to be reduced. Online claims, so it's going to be quicker. You can get faster service. And the reimbursement part is as little as 48 hours. So that's a huge turnaround to get reimbursement, something that we're not quite used to. The mobile app, really huge. If you're a tech person like me, I love technology. You get to sign in with your fingerprint, Touch ID. And that screenshot, you can actually see a little bit of the design. That's basically what it looks like. You can take photos of your receipts and submit claims, and you can look up your coverage. So you're down the road and you know you got to go get, your dentist has told you got to get a crown done. Normally, it may not be covered, but you can actually see, look on the app, press a couple buttons, you'll be able to know exactly what you're covered for, and you'll be able to see what you have coming up next. So you can forecast your health plan. It's quite different from what we've been experiencing over the years, because we never had that as individual clients. We've never had the ability to look into the future and see exactly what health plan we can choose. We can choose something quite different than being told what you can choose. That's my own personal perspective. So a little bit more of the dental plan highlights. If you're still on the call, still got lots of time. Exams and cleaning, increased frequency to 2 per year. Fluoride, 2 treatments per calendar year, and no age restrictions. Night guards, and I know when I first heard about night guards, I was like, how is that a benefit? What would that be as a benefit to me as an individual? Well, those night guards, I've heard from a lot of community members who've said, without those night guards, which they had to pay on their own, their teeth would grind at night and would cause more damage to their teeth and eventually have to get more coverage, which was hard to get covered. So that night guard is actually going to prevent so many people from further damage to their teeth. It's a preventive measure that's going to hugely impact positively health for our clients. Dentures, increased frequency to once every 5 years. So one thing that I wanted to mention with dentures is if there's for some reason you're out fishing and you cast out and your teeth end up in the river, the good news is normally it's going to be tough getting that replacement. But under this new plan, September 16th, you're going to be able to get a replacement right away. No questions asked. But some people say, well, James, what happens if it happens again? Maybe I'm at a ball game and they get hit in the mouth with a baseball. And their dentures are all over the place. Well, of course, the third time might require a little bit more paperwork, not as instant. But the reason why I'm mentioning this is because I think people should know that it's important to know that this is based on the client. And there's no reason why clients can't ask to get help with their plan. So it's really important to also talk about appeals. There is a process. I'm going to skip over to bridges, crowns, veneers, inlays, and onlays. So that was the one I talked about before. I really felt was very important. Eligible with no prior approval required for up to 4,500 combined limit in a 5-year period. So as I mentioned before, on average, it's about $1,000 for a crown. So this is a huge increase for clients. White fillings, definitely eligible for coverage. So back to the vision plan highlights. Eye exams and sight tests, eligible, $100 every 2 calendar years. So give that a bit of context. On average, it's about $100 from what I've seen. But in the past, we were only covered for $37. So this is a huge increase. And there's less time waiting for an approval. Eyewear, you need no need for prior approval. Standard prescriptions, eligible for $275 every 2 calendar years. $415 for high index glasses. Direct payment, where available. Ability to look up participating vision providers. From what I understand, I've seen some plan designs, and on their website, PBC might actually have a digital map to look at service providers. And I think it's when you actually register in the PBC portal, you can actually look up the service providers in your local area, which is quite interesting. With vision. Support for clients with complex needs. I think that's the one that a lot of people have questions about. We know that family members, clients, they have multiple needs. So that's what we're here for. So MSNE, medical supplies and equipment plan highlights. Hearing, prior approval no longer required for eligible hearing aids. Replacement every 5 years. Faster adjudication and simplified claiming. Reduction in prior approvals required. Pharmacy claims as of September 16th. Most drugs continue to be covered through BC PharmaCare Plan W. Pharmacies can submit claims to PBC if client is not enrolled in Plan W. FNHA is working with pharmacies to support clients who do not have coverage to enroll in Plan W. A small number of supplemental drugs will be covered by PBC. Pharmacies can direct bill for medical supplies and equipment. Supporting FNHA clients through change. So before September 16th, number one, you would contact your regional FNHA Health Benefits Community Relations representative at communityrelations@fnha.ca for resources. You would help communicate the upcoming changes to your members and mention it on your local providers. That's kind of the work that we've been doing prior to transition. But after September 16th, the change will be sign into your own PBC member profile and see what's covered. Check for updates and resources posted on our website, fnha.ca/benefits. And refer to our updated health benefits information package for information on how to access all FNHA benefits. And some of you have asked in the questions if you can get a copy of that. Clients without online access can call our toll-free number for assistance.